My screen must be visible, just a cross check.
Yeah, it's visible. Okay, that's good.
Okay, fine. Thank you. Good morning, everybody, and thank you very much for the opportunity that we had for this particular webinar. In fact, it is our great pleasure to be the part of this cardiac CT and MRI webinar. And we extend our sincere thanks to organizing committee, eminent speakers, and all the guests who have joined us online today. Today, I'm going to share the small introduction of Fujifilm and also the cutting edge technologies what we have in our system. I will try to finish my talk within 15 minutes of time as it has been assigned to us. First, a small introduction of Fujifilm Group. We are into imaging solutions, healthcare, and document. And these are the three major core areas of Fujifilm. And in healthcare, in fact, we have three major areas again. And we are working in three major areas as diagnosis, prevention, and treatment. And today, obviously, we are more towards the diagnosis part, where we had a wide range of equipments, but with the merger and acquisition of diagnostic imaging business of Hitachi, we are as a complete diagnostic solution provider. In fact, just a brief idea, we got support offices all around the world and some of the product line. Let me directly come to our CT scanners, which is the major topic for me over here today. In fact, we have two broad range of CT scanners, what we define in terms of the size of detector, that is 40 millimeter detector and 20 millimeter detector. In 20 millimeter detector machines, we refer it as non-cardiac system, and also for 40 millimeter detector system, Supriya, we do have the non-cardiac as well as cardiac option. Scenario View is our dedicated cardiac system, and today I'm going to focus upon Scenario View, which has many advantages in terms of the imaging, and as shared by some of the speakers, that in case of cardiac CT, the major challenges we get are the radiation, the scanning time, it has to be very fast, and also how different processings and radiation reductions can be done. So that's the main topic which I'm going to share with you today. Scenario View is basically based on three design pillars. These are low dose to the patient, faster scanning, and comfort to the patient. First, let me come to our next generation iterative processing called IP. What happens the time when scanning is being done and the reconstruction is being done, the image, it changes in the texture. When I say image change in texture, I will explain you in my further slide. And all of this process actually takes a bit of time in calculation, dedicated equipments are needed. All of these things we are able to remove in our Scenario View scanner. Scenario View scanner, in fact, it is based on the IPV, which is based on the visual model, which includes the object model, physics model, and statistical model to create the final IPV images. These IPV images, it maintains the image texture. The high-speed image processing we are able to provide, and image noise we are able to reduce by 90%. And because of this, the dose reduction, we reduce up to 83%, and we are able to improve the contrast resolution by double. And these are the major points which comes up in Scenario View, the time when we look at in terms of the scan. Okay, let me come to very small physics, because we are looking more towards the teaching here. So very small physics I will pick up. As you all understand, the time when scanning in CT scanner is being done and we take the images, we make the reconstruction, and it is called filter back projection or FP. Here, I'm showing one graph to you, And this graph is a frequency domain. And in the frequency domain, on the x-axis, these are the frequency, and on the y-axis, these are the normalized NPS, which refers towards the MP. So the time when we get the image from FBP, which is the actual images, that's the curve which is being followed. But what happens nowadays? The iterative reconstruction which is being used nowadays in, I'll say, 100% system, the quality of images reduces, although image looks smoother, because the frequency domain shifts more towards the lower frequency side, and which causes a huge amount of degradation of the image quality. But in our IPV, we maintain the same curve as original FBP. And because of this reason, we refer it as the texture of the image remains same. Let me share the first phantom images, then I will come on the actual images. On the phantom image, when filtered back projection image, if you look at, it looks something like this image. As you can see, it's quite grainy. But iterative reconstruction, which is being done nowadays, we are able to make the image looks smoother, but details are being lost. And with the help of IPV, we manage similar texture, and at the same time, signal to noise ratio is being reduced. And that's the benefit of IPV, what we offer. Let me come to the specific image now. As you can see or appreciate the liver image, FBP, very grainy, iterative recon, smooth, losing the detail, but IPV, same image and appearance is very, very fine. So very fine quality images we are able to generate with the help of IPV. Little zoomed image so that you can just look at the lesion, all the three images. Although it is being seen, but in current iterative recon, the display is a little bit blurred, I would say. So that's the advantage. Now, let me move to the next point here in terms of the wide gantry size. And we do have the side sliding motion in the system, and which really helps us to get a good quality of image. This I will pick up more in detail further down. Then for the bit of faster workflow, we have the auto positioning, and with the help of auto positioning, we are able to reduce the scanning time which is being taken by setting the patient, and everything is automatic in this case. Now I will come towards the dose reduction, which is one of the major things nowadays. We do have Intelli EC+, this is dose reduction, which works in 3 dimensions. And with the help of that, we are able to make a significant amount of dose reduction, like in this particular case, from 21.8 milligray to 13.6 milligray. With the help of Intelli EC+, we are able to reduce. That's quite significant. This is for whole of the body. And in case of ECG scanning, we do have 2 kinds of scan to work for. One is retrospective scan and one is the prospective scan. In case of retrospective scan, the time when scanning is being done, the X-ray remains on throughout the scanning time. But in prospective scan, X-rays are being on only for a specific time when heart is at maximum stationary position. So point here comes up is retrospective scan, we suggest to carry on if patient heart rate is varying or changing, and prospective scan when heart rate we find to be quite stable. So depending upon how the patient condition is. To reduce the doses further, we have come out with one new technology. We call it Intelli EC Cardiac. Here, what happens? The system keeps on monitoring the condition of the heart on a continuous basis and makes the scan based on the time when system or heart is at maximum rest position to get the best possible images. We do have one very interesting technique in our system, which is quite unique. So let me share this particular technology with you. As you understand, CT scanner, the way it looks up is on the top, we have the X-ray tube. That's the compensation, means we make the fan beam. And further down, we have a detector. This is patient table, patient, and this red color is our target, that is heart. In a normal way, that's how the scanning goes. And once this scanning is being done, we measure that how much amount of X-ray exposure has happened to the patient. Okay. We call this a Monte Carlo simulation. And based on that, we find there was a huge amount of radiation to the patient. Now, what we did, we reduced the compensator to a smaller one so that we are able to focus only on a smaller area. And we shifted the table to the right side so that the patient comes exactly at the center. And now, when we made the scan and measure the amount of radiation, it was focused only on the area which we were planning to work out. And we were able to make the dose reduction 35% outside field of view and 23% in the whole of the body, and which is very, very significant because in cardiac, as shared by some of the speakers, that there is a huge amount of radiation. And that's a very interesting solution what we offer. And at the same time, since the heart is exactly at the center of the X-ray tube, the spatial resolution of the images increases tremendously. And this point, it comes up because some of the artifacts which are being generated, blooming, de-blooming, and strand kind of artifacts, those can be minimized to a larger degree. And since the radiation dose is one of the major things, so we do carry out all this data in a simple dose report and DICOM dose report so that we can calculate and we can see and manage that how much amount of radiation is being given to each patient. Now let me share some of the image qualities I will be talking with you. One is the combination scan we have. In case of combination scan, what happens the time when you work for the cardiac scan and when contrast flows down further and if patient is symptomatic, we can pick up the whole of the body for the scan. An interesting part for us is we work at 0.35 second rotation for the whole of the body for the scan. So the time taken for us in terms of the switching of scan condition change, we are able to reduce that by almost 4 to 5 seconds. And this reduces in terms of the requirement of contrast to the patient. And that's quite significant amount. Then one interesting software we have come up with, we call it Cardio Conductor. Now what happens the time when scanning for heart is being done, we ask patient to hold the breath. And as physiologically, the time when breath hold is being done, the heart rate, first it goes high and then it reduces, and which gives a kind of, oh, there is some, we are not sure what heart rate should be. So to take care of that, we have come out with this solution called Cardio Conductor. Here, what we do, the time when scanning is being done, just prior to it, the time patient is being put on the patient table, the ECG electrodes has been fixed. We can see the heart rate. We ask patient to make an exercise of 10 seconds for breath hold. And this breath hold data is being monitored by the system in conjunction or in according to the heart rate as well. And when these two things are being merged together, system comes out with a scanning plan or say protocol setting, and which is available in terms of 3 modes, auto, semi-auto, and manual. And based on the choice which we leave it at the operator side to choose any one out of it, that is auto, semi-auto, and manual. And as the name says, manual, all parameters are with you. Semi-auto, only heart rate can be edited, and in auto, everything is uniquely determined by the system. Idea basically with this kind of software is it gives a kind of confidence to you the time when cardiac scanning is being carried out. Then we do have the ECG data, and in case you get some kind of arrhythmic signal during the scan, that particular peak can be removed and you are able to get a good quality of images without any issue. Now let me share some of the images very quickly. I won't take much time. Here I'm just starting with the 4-phase images of the liver, just to give you a broad idea, and dissociative aorta. So this kind of images we can very well reconstruct in our system, and we can get a very nice image quality for this. Here you can see the left femoral artery with occlusion. Let us come to the cardiac directly. In this particular case, acute myocardial infarction and the soft plaque. Now, if you look at, there are two areas we are focusing here on LED. One is the stent, and second is the soft plaque, which is there. In case of stent, we do have two kinds of filter. We call it soft and the sharp. And with the sharp filter, on the actual images, you can appreciate each flanges of the stent very clearly. And on the soft filter, I mean, the time when we look for the soft plaque, actual images, you can appreciate it out and how a particular soft plaque is being seen on the actual images. Here, the stent evaluation. And this stent evaluation is basically for the patient which the stent is already been put, and we know what patient condition is. So it's something like a regular health checkup, I will call it as a reference. So this kind of patient has to come for a scanning. I don't say quite often, but maybe once a year, or maybe twice a year, or maybe once in 2 years, depending upon how the patient conditions are. So idea here is for this kind of patient, we need to give minimum amount of radiation, and that's what we are going to take it here. The scan is being done with the prospective scan, very specific alert or specific radiation is being used. Just 0.5 millisievert we use to get this kind of images, and you can appreciate each dot of the stent in this particular. And that's the kind of image quality we generate in our system. This is preoperative ablation. So just broad images, LCX and LED, but you can appreciate out nicely. This is little interesting to share, mitral regurgitation. And here, as you can see, the heart rate is a continuous variation, like 42 to 72 when continuously moving. And this kind of situation, when you get, you are at a very challenging scenario, how to really work it out for what particular and how the reconstruction has to be done. So to take care of that, we do have a software. We call it CardioHarmony. This CardioHarmony software, what does it do? It basically identifies automatically the optimal cardiac phase which is being used. So the processing which is being done for this particular patient at 2 places, like for 75% when it's been done, so nicely seen. But the time when we look at the 92%, which has been identified by the system, obviously the RCA can be very well appreciated. So again, CardioHarmony is a software which assists the time when you are working on the system. Here is an example of CABG. In fact, very interesting point which I want to share with you. Obviously, it's a post-operative is a CABG. You can see that how the particular grafting has been done, and the graft can be so nicely visualized and shown by us. And obviously here the scan what we did, it was slightly more. It is more than the heart what we covered because we wanted to cover the grafting as well. But very, very, very perfect images, a very perfect view what we really showed you. Here, this is the ECG modulation. So 45% dose reduction, and the combination scan, which I just shared with you, and that's the image quality, what we can achieve with the help of our scanner. So speed, comfort, quality, these are the three areas what we refer in our system. And the differentiating feature for this, for the speed, the challenges what we face are the throughput, patient positioning, and patient motion. Our solutions are 0.35 second scan, synergy drive, and motion artifact removal. For the comfort of the patient, claustrophobia and the long scan are the points which are discomfort to the patient. Our solutions are 80 centimeter wide bore, fast scan, wide patient table. And for the quality, the challenges we have, small lesion, metal in body, and radiation. Our solution, IPV, HIMAR, with the help of HIMAR, we are able to remove the metal artifact which causes the artifacts to come, and 100 kV low dose protocols, which we are using in most of our scanner or most of our anatomies what we scan. So very effectively, we are able to reduce the amount of radiation. And that is all from my side. If any questions, any query you may have, please feel free to ask. Thank you.
Okay, thank you, Mr. Atul, for your presentation. That was so good and enhanced our knowledge about Fujifilm. And also, there are some questions in the chat box, Mr.
Sure, sure.
You could have a look at the Zoom chat. Okay, the first question would be, is the Fujifilm CT scan do CTA cardiac with low dose?
Say again, sorry. I think okay, I can see the questions here.
Okay.
Patient with high HR high and still high after give beta blocker, but doctor instructing must be to do CTA. Which CT scan are accurate to do its slice? Oh, okay. See here, obviously the best, if I look at from the point of view, like we need to complete the scan in say just one rotation. So if we are able to make the scan in a wide or say bigger detector, that is the best. So from slice point of view, I'll keep the slice away, but definitely 160 millimeter kind of detector are the best for this kind of scenario, because those are quite dedicated scanner which comes up.
Okay, next question, sir.
Okay, next is how much is the radiation dose on this CT Fuji in one-time CT cardiac exam normal dose? As I shared, in case of prospective scan, we are able to bring down the doses to 0.5 millisievert, which is almost, I'll say, equivalent to one chest X-ray or rather smaller than that. At that time when we go for a normal scan, depending on the coverage what you are doing, approximately the amount of radiation is going to be 1 to 2 millisievert, which is again quite controlled what we are really looking for.
All right, the last question.
This is Mr. Atul. What are the iterative reconstruction technique, drawback, or pitfall to represent signal and image reconstruction in CT scanner? In fact, what happens is in case of iterative reconstruction, as I shared in my presentation, it moves the whole reconstruction curve towards the low frequency domain. When it goes towards the low frequency domain, which refers to the lower resolution, and this causes your machine or your images to look very smooth, and you lose the resolution into it, like the line pair per centimeter what we refer. So that becomes less at that point of time. So that's the reason iterative recon, although it looks good from the overall image point of view, but you lose the resolution or spatial resolution and information. And that's where we are coming with IPV. And I'm very sure industry is going to change very fast towards this kind of situation. I think these were the 3 questions what I had. There is one in Bahasa.
Thank you.